Heidi Lindsay worked hard to keep her father alive, visiting him every day inside his care facility. Pandemic restrictions locked her out, and he died a few days later. Now she sits on a task force that's been hammering out new visitor rules in Saskatchewan.
I have absolutely no question in my mind that I could have continued to care for him and not be any greater risk than the hundreds of people that work here every day.
Until now, visits have only been allowed for people who are dying, having a baby, or undergoing major surgery. Now, most hospital patients would qualify for at least one support person. Those visitors will be screened. This epidemiologist says physical distancing should also be enforced.
When you go to see somebody in the hospital, the first thing you do is you lean in, you want to touch them, you want to fix their hair, fix their gown, those kinds of things.
Actually, I'm working in the critical care unit. I can tell you that our staff are very happy to be able to start to welcome more families into the hospital. And I think that we're going to have a lot of happy people within long-term care as well.
Some long-term care residents will be allowed 2 visitors inside if, and only if, their needs are not being met. That's a vague criteria that officials admit could create confusion and turn some families away. Brenda Moffat's 85-year-old mother has dementia.
The phone calls that you get because she's so confused.
She says choosing who gets to visit will be difficult.
Like, how do you prioritize who is most important in her life?
Hi, we miss you, puta.
Outside visits, like this one for cancer patient Renato Francisco, will become more common in both Manitoba and Saskatchewan. Patient safety experts say giving families more access will improve health outcomes. Heidi Lindsay agrees.
My dad should serve as a warning of that.
Because families can help safeguard their loved ones. Bonnie Allen, CBC News, Regina.